long time, we've been telling our people to take neatness as a matter of importance and urgency.
The disease, known as cholera, originated from India, and the first cholera pandemic began in 1817, spreading from China to other Asian countries. In recent times, Nigeria community has been battling cholera for the past couple weeks. The country has experienced multiple cholera outbreaks with significant cases reported from various states. 25 states have reported a total of 815 suspected cases, including many deaths, resulting in a case of fatality ratio.
All my chiefs are aware, and they've been going around telling people as to what to do. The government has been saying, telling the schools children to wash their hands. No, it is our people that are stubborn.
According to a medical expert, Dr Muyiwa Rufus, cholera is always caused by ingestion of food or water contaminated with bacterium vibrio, and it is always spread by eating foods or drinking water contaminated by the feces of infected person.
Cholera is an intestinal infection, and the reason why it's so endemic now is because of the mode of transmission, which is usually fecal oral. So it's because, as we all know, Nigeria can be described as an underdeveloped or developing country. So there's a high rate of all this unhygienic practices and everything. So these are the factors. These are more the factors that can actually make this kind of illness, make it endemic and make it spread further and further. Cholera can spread through two ways. There are two reservoirs for cholera. There's the human factor and there's the water factor. The human factor is through person to person transmission. Then there's this fecal oral transmission, in which human get in contact with feces. It might be through contaminated water that we take in, or it might be contaminated food that we take in. So eventually, if we find ourselves taking contaminated water or contaminated food, this could spread cholera.
Dr. Taye Ayorinde, Baale of Ekotedo, Ibadan, enumerated how the disease spread and measures to be taken by individual and government to curtail spread of the epidemic.
Number one, for it not to spread, we have a saying in Yoruba which says, "Imototo obori arun male." We've told our people they must be very, very conscious, and they must wash their hands when they go to the toilet. Most homes don't have water closet. I think the government will make it a rule, a point of duty, to make most homes to be more than mere salanga pit hole. But the question is the pipe water flowing? In this area, we've seen pipe water for at least the last time we had pipe water was about 10 years. So the government will do something about that, I believe. The other aspect is that all these roadside sellers of foodstuffs, the Ministry of Health had to take a proactive action in inspecting where they get water, what type of water they use in cooking, selling food. This, especially most of these secretariat, most of them don't have water. Some of them they use Ibule water. So what do? I believe certainly with more publicity from the government point of view, nothing nothing will stop our people from being clean.
In an interview with Ruler's World TV correspondent, Dr. Rufus disclosed how deadly cholera could be if not properly managed.
One of the symptoms is what we call secretory diarrhea. So it is a kind of passage of watery stool in a voluminous quantity. So it's very, very deadly in sense that person can start to pass loose stool, and within 24 hours or even few hours, the person will enter severe dehydration, and it might actually lead to death.
Dr. Rufus mentioned the symptoms of cholera and stated further that cholera could be prevented with maintenance of hygienic environment and self-control if one contacted with the disease.
There's secretory diarrhea, there's abdominal pain, plus or minus vomiting. But the most important symptom is this diarrhea that I mentioned. And how will you recognize this diarrhea and say, okay, this is cholera? At some extent, the person will start passing what we call opaque white kind of stew or rice water type of diarrhea. Recognize it early. Then, if not, if it's getting to what we call severe dehydration, then the patient might need to be referred to the hospital. But one important way of managing cholera is hydration. So when you see somebody that is suspected case of cholera, it's very important that the person be well hydrated. This ORS, that's an oral rehydration solution that anybody can get anywhere that we can actually use. Prevention of cholera is number one, through proper hand washing techniques for everyone. Like, everybody has to know how to do a proper hand wash, especially after day-to-day activities. This is one of the ways in which we can actually curb the spread of this cholera. Another way to prevent this is proper sewage disposal, because like I mentioned, it spreads through contaminated water or contaminated food. Now imagine people that go to stream or this way to relieve themselves. So if you have a good sewage disposal system, it's going to go a long way. Then the third way is if you have clean water for everybody. I think this is one of the ways to which we can prevent the spread now.
Cholera pandemic usually occurs in an underdeveloping and developing countries lacking proper water supply and sewage disposal, among which Nigeria is not an exception. Onikende, Rulers World TV.